So digital-first future of fallacy. So I have to admit to obviously being a little bit biased on that particular question, being somebody who 9 years ago now set up a business to try and solve that exact problem. And DrDoctor came about because I was doing delivery projects in hospitals. So it's really pleased me that a lot of the conversation today has been about the how and the adoption, not just the technology. And I particularly remember sitting in the outpatients department of a hospital in Coventry, watching all of these patients turn up at the front desk with bits of paper that say different things, and it being incredibly confusing and incredibly stressful, incredibly hard to be a patient. Meanwhile, I was trying to run a transformation project to save some money in this organization. So I thought to myself, like, how hard can it be to solve this problem with a little bit of tech, hey? Little did I know that 9 years later, we'd still be beating on at this. And actually, like, people have been talking about digital transformation in the NHS for 20 plus years. I saw a tweet the other day from a Guardian article from 2003 talking about how we're going to have a paperless NHS in 2 years' time. Here we still are. And one of the things that we realized is that how difficult and how important that change management journey was and is. So I used to stand up and I used to talk about this idea of gentle disruption. And so much of the progress that we made came through this concept of gentle disruption, which was the idea of changing healthcare systems from the inside out. And you do that through augmenting and understanding existing process rather than just trying to disrupt it. And it's one of the reasons that so many tech-enabled projects failed, is they thought, oh, we're just going to change this without actually understanding the system and understanding the incentives. So we spent a long time coming up with this concept of gentle disruption, which is you start by engaging the patient. Once you have a large percentage of your patients onboarded onto the idea of using digital, you can then automate. And once you've automated, you can then create clinical change. And the really exciting thing about where we are today is we can begin to start to talk about some of that clinical change. And the talks that Paul and Graham gave, I think, talked really coherently about that. So we were happily going along doing this idea of gentle disruption, gently disrupting the NHS. And then this little thing called the pandemic came along, and it kind of reshuffled the pack a little bit, right? And it suddenly accelerated what everybody was doing by kind of 10 years. So post-pandemic, 2 years later, we've seen 1,000% increase in the total number of patients engaging in our platform. We've gone from having no organizations using digital to 55% of our organizations in the North using digital, which, by the way, somebody told me is 20% higher utilization than any of our organizations in the South. Not that it's a competition, but there you go. The North-South divide clearly delivering in the North. And a 400% increase in the number of patients choosing to use digital rather than post, which I think is a really interesting statistic as well. So there's been like this huge adoption, right? But the really interesting thing is over the last 6 months, we've seen it slow. And when I talk to everybody else in the industry, my friends that run startups, people that run large health tech organizations, everybody has seen the last 6 months slow down. And I think a large reason for that is a lot of the change that happened over the last 2 years was really tactical. It wasn't strategic. It was people going and doing stuff to fix holes in the system. And the opportunity we have now is to think about that differently. Because ultimately, we still have this same fundamental challenge that we've always had, which is that supply and demand, like the demand for healthcare service, does not match the capacity that we have in the system. And that problem has been rising very slowly for the last 25 years. And what the pandemic has done is it's made it 15 times worse. So we've accelerated 10 years into the future, but we have a supply and demand issue, which is so much worse than it ever was before. And the only way that we're actually going to solve that is by thinking very differently about how we deliver care. And it's really rewarding when you sort of prep some notes and everybody before you talks about this fact that we actually have to go through a significant change. And we have to stop thinking about healthcare as a kind of a one-to-one, place-based kind of service and business, and start thinking about it as a data and collaboration-based business. And it's that shift which will allow us to fundamentally deal with this underlying supply and demand problem. We've got to break down the primary and secondary care barriers, and it's great to hear about networks being used, because I think that's a massive part of enabling the adoption of this change. And something which we all have to do as change agents in the system is understand how we can break down all these silos that exist. So, for example, we have something like 20% of all NHS outpatient activity now goes through the DrDoctor platform, which is really exciting. We don't do anything in primary care. So we're working really hard to build strategic alliances with primary care and work with ICSs to bring primary care information to the platform so you can start to think about the whole life patient journey. It's about also allowing people to collaborate across those care journeys, providing communication tools, not just between patients and doctors, but also between clinical teams, because it's there that you see innovation begin to happen naturally, and ultimately to focus on patient outcomes. Because I think we're really close to this world where, as a clinician, you can manage your patient cohort using a digital dashboard. You know, Cerner can show it. You know, Cerner can show it being done. But actually, we've got the technology here in the UK to do that today. We really do. It's there. And as a patient, to see the right person at the right time, based on need, not just because you're next in the queue. And I think that is one of the fundamental changes which we're right on the cusp of doing, and the people in this room can force through. And most importantly, get rid of that reliance on those confusing bits of paper that I talked about 9 years ago. Wouldn't that be great? So for me, I think the point that I wanted to make today is it's time to remove the gentle from the gentle disruption piece. I think that's done. I can put that away. You know, I used to stand up at conferences and I used to ask, you know, how many people have got a mobile phone in the room? I mean, that question is not really a 2021 question to be asked. I think the other really key bit is that everybody's up for it. Like, it's really interesting talking to people in the system. We've all realised that we need to make this change, and that is really, really, really different to how it was 2 years ago. I really think we have an opportunity if we work together and we collaborate. Hence, we ran this event. Hence, we're trying to connect the region to force this change through and take advantage of the platforms that already exist. As I said, huge percentage of outpatient activity already on our platform, and there are lots of others in similar places, to create the change the NHS needs. Because ultimately, like, creating change in healthcare, solving the adoption problem that we talked about, is it's about bringing together the best of clinical practice with the best of change management and the best of technology. And it's when you bring those bits together and you look at the problem as a whole, that you actually create change. I saw a really amazing tweet from someone who was an ex-Future Gov guy the other day, which was saying that digital transformation strategies are about execution and delivery. And execution and delivery is the strategy. And I think that is 100% true. Everywhere where I am seeing success in digital transformation is where you have individuals, like the people that have spoken tonight, who forced through change. And is one thing we take away from today is to get digital transformation right is about aligning those three pieces and then focusing on execution. So to get to future, not fallacy, is going to take ambition, it's going to take willing, it's going to take work. But the prize is massive. So we did a bit of maths for one of the online journals recently, looking at the backlog. And we reckon you could take the backlog down from 4 years, we've got a 4-year elective backlog at the moment, to 8 months by just applying pragmatic technologies that already exist today. That's how big the prize is. And I think when we talk about that sort of change, we are ultimately talking about the sustainability of the healthcare system we live in. So for me, is digital-first healthcare future or fallacy netta? I don't think it's either, actually. I think it's right now. We're living it. That's all I'm going to say, because I know we're waiting for dinner. But does anyone have any questions?
Thank you, Tom. I'll start with a question.
Yeah,
so you mentioned the unspoken north-to-south divide. Why do you think digital adoption is higher north than east and south?
Oh, I mean, there's a loaded question, right? I don't know. I think we've seen a real willingness to change in some of the northern organisations we work with. I think geography plays a part. It's really interesting talking to Nev earlier about health inequalities and the effort and the time that people are putting into that sort of stuff and really thinking about those problems from first principles. You don't see that thinking everywhere at the moment. I think there's some really good networks happening. We were talking about some of the ISISs up here being more established. I think that helps. I think different parts of the country are on different parts of their own change management journeys, to be honest. And I'm sure there's huge variation within each patch as well. So yeah, it comes down to people, Netta, as always.
Tom, we were discussing earlier how platforms like yours are now looking to integrate with others in that space. I wonder if you could maybe expand on that a little bit, what you see the future of partnerships with other innovators for that sort of pathway solution. Group, a part of it, of innovators to help solve these.
So I've always believed that nobody can solve this stuff on their own. Like, anybody who thinks that they have the big hairy answer to healthcare in one product or one platform or one change management journey is wrong. So we've always sort of taken a kind of a really front foot approach to partnerships. So we, for example, have done things like we work with Patients Know Best, who have a personal health record. We've created a federated identity service so that a patient can log in once to their platform or our platform, and they have a seamless experience. Because I'm not trying to build a PHR, I'm trying to build a transactional system. So why try and compete? Like, you should work together. We're trying to build really strong relationships with primary care providers. So people like eConsult, others in that space who are leading the way in terms of kind of primary care triage. What we see our place as is bringing the data that they have together with the data we have to allow ICSs and to allow clinicians within organisations to work beyond the walls of their own hospital. So I see my job as part of the ecosystem to make those connections happen. They're not going to happen naturally, and then enable others to build change on top of that.